Hello friends, ladies and gentlemen, welcome to the Raymond Nicolet Trust Podcast. My name is Gavrilo Nikolic, and every month I bring you inspiring conversations about the future of education, science and philanthropy from world top academics, scientists, Nobel Prize winners and philanthropists. My guest today is Dr. Roberta Bernardi. Roberta currently works as a senior lecturer in management at the University of Bristol in the UK. She earned a PhD from the University of Warwick in 2012 and was a lecturer in information systems at Royal Holloway, University of London from 2014 until 2018. She has almost 10 years of research experience in ICT for healthcare, including research on health information systems in Kenya and more recently telehealth and online health communities in the UK. She hopes that her research will guide academics, policymakers and practitioners in the formulation of IT policies and strategies to support healthcare integration and patient-centered care. If you're curious to learn more about the digitalization of health, you need to listen to this episode. In just a moment, the one and only Dr. Roberta Bernardi. Roberta, welcome to the RNT Podcast.
Hi, thanks.
Let us start with basics. Where are you currently and what are you doing?
Yes, I'm a senior lecturer at the University of Bristol in the UK. I'm also director of the MSc in Business Analytics in the same university, and I teach various courses, one of which is a course on artificial intelligence and also digital innovation in healthcare. And I'm currently working on a project on online health communities. Particularly in this project, I'm looking at how members of these communities exchange and consume medical knowledge.
Quite exciting topics you're working on. We're going to take a deep dive in some of them, but before we do so, let us go in your personal history and explore a little bit when did you originally take interest in digital technologies?
Yeah, it was during my undergraduate degree because I did a course on information technologies back then. Actually, my degree is in the humanities, but in foreign languages and literatures. But they actually had this course in information technologies, this specialization in information technologies, which I took, and following that, I did a dissertation on information technologies in Africa.
That's quite exciting. So can you maybe tell us a little bit more about the nature of that course on information technologies? What did you learn there that really prompted you to study further the information technologies?
Yeah, I guess the whole world of information technologies fascinated me. And particularly when it comes to, I was more interested in how actually you use information technologies to solve problems, more than the technical aspect of it, and how actually we as users, as humans, organize our life around information technologies, really. And that's why then I guess later on I wanted to find out more about the use of ICTs, of information technologies in Africa. So what sort of impact? I guess that was also linked with my interest in international relations back then, and therefore I thought that matching these two interests between information technologies and international relations, by focusing on Africa back then, it would be an interesting topic for my dissertation.
You mentioned the word Africa for several times now. Can you maybe tell us a little bit more about the project you did for your PhD dissertation?
Yes, actually, it all started with that dissertation back then. My undergraduate dissertation took me to Kenya as an intern, and then I did a few jobs in Kenya. And when I decided then to do a PhD, I then found a course in the UK. in the University of Warwick. And because I had this connection with Kenya, and I also back then I wanted to use my PhD to work in international organizations, and I had an interest in the World Bank, because I knew that for certain organizations you needed a PhD to actually get a job. Then I actually wanted to do a PhD on information systems for the Inland Revenue Authority in Kenya, but my application was rejected. And then I had a PhD colleague who had contacts with the Ministry of Health in Kenya. And that's how my journey on ICTs or digital technologies in healthcare started. And so I did this. My dissertation is actually on health information systems in Kenya, and it looks mostly at how different actors, such as donor organizations, but also local actors, so users, sort of shaped the implementation of these systems across several years. So it was actually taking an historical perspective.
That's quite interesting, Roberta. I'm just interested, maybe what is the main outcome? What was the main conclusion of the research you did in Kenya?
When they started actually talking about information systems in Kenya, there was this huge debate. So in global health, between about selective care and universal primary care. And this is then, and obviously there were basically a lot of donor pressures were actually influencing the way these systems were implemented. So it ended up that these systems were mostly satisfying sort of the needs, information needs of donor countries or international organizations that were funding healthcare programs in Kenya. But they didn't have a sort of a more holistic or integrated approach to the development of these systems. So it often ended up with a lot of fragmentation, and therefore there was little coordination or integration of information across different healthcare programs, which also limited what you could do with the information that you were collecting, particularly in terms of developing healthcare programs that would address the needs of the local population. At the same time, mostly users of these systems, they couldn't appreciate the value of the information they were collecting, because obviously they were mostly collecting information from the ground or data from the ground, mostly to report to the higher levels of the health system, such as national governments and international donors or funders, but they couldn't really see what they could do with that information in terms of, for example, I don't know, developing programs, local health programs that would address the needs of communities, the healthcare needs of their communities.
That's quite interesting what you said. Based on your experience in Africa, I can, at least for me personally, conclude that the problem was not obtaining data and having the right information technologies in place, but rather understanding what are the needs of people and using that data to their advantage.
Yes, exactly. Obviously, the technology plays a huge part, but there have been, like, for example, when I started my project, the information systems was actually paper based, but then and obviously then it all moved across as different types of technologies, and nowadays likely we have more advanced technologies that can be accessed cheaply, because you are not constrained to proprietary software. And there are actually interesting programs in Africa, like the University of Oslo has a very interesting program. They have been working on these programs for several years in terms of actually giving access to open source health information software for health information system. So that's definitely an issue. But there's also the thing of what you do with the technology. So what is the purpose? What is that you want to achieve? What is the value that the users then gain from using these systems, that obviously then influences how they use these systems, whether they use them effectively or not. For example, whether they report the correct data or they actually misreport. And this is all linked about, a system should be also the ownership of the system. So is it just the ownership? Is it just with the organizations who are funding the system for their programs, or is it actually something that the users themselves on the ground can benefit from?
That's a great thing you just mentioned. I fully agree with everything you stated. As someone who is a user of many applications and many programs, I think the biggest issue is definitely not that there are great apps out there, and many of them are great, but really how the developers on one hand and how users on the other hand learn from each other, and how there is a feedback between two sides, so you can really make the ICT system in hand, or even a particular app, most useful and really effective, so it brings the benefits to both users and developers in the long run.
Yes, absolutely. So, and most of the times, actually, the design of software and applications, well, at least based on my thesis back then, it wasn't really made by having the key users in mind, and obviously, then then it's difficult then also to have acceptance of these systems, and to have these systems being used properly.
Roberta, you mentioned your interest in many topics that are related to the healthcare of tomorrow or healthcare of today, like artificial intelligence. But I'm curious, how do you see the telehealth that has actually been heavily implemented in the last 20 months since the onset of the COVID crisis? How do you see the telehealth developing in the next 10 years? Will telehealth become the new norm, or at least first port of call for patients and their GPs?
Well, when it comes to online consultations, I guess now, obviously, I'm referring to the UK in particular. The use of technologies, particularly in terms of online consultations, has increased, and I guess it may diminish going ahead, because some patients still want to actually have a direct contact with GPs. Not all patients actually. We need to distinguish different. So there are different types of patients. So, for example, there are patients who suffer from chronic diseases and may require, or maybe they are elderly, and may require more attention and more personal contact with their GPs. For these people, fundamentally, maybe online consultations is not really what it doesn't really fall under their idea of quality healthcare, particularly if they feel they want to be seen. They want actually to be physically visited by a GP or primary care doctor. But obviously, I guess we've all experienced the situation of having a doctor's appointment and maybe having to take off 1 or 2 hours of leave to actually go to this doctor's appointment. So for other people who maybe just need a prescription, or they just have an issue that they want to talk about with the doctor, certainly online consultation is a good thing to have. However, I think telehealth is more complex than that. So if we think about telehealth in terms of care from home, which means basically monitoring patients who are affected by multiple chronic conditions, and who risks being admitted to hospitals, and actually preventing those patients from getting to hospital, and also being autonomous, empowering those patients. Then you need a different type of technology, but you also need a different type of organizational setup. So I think, for example, in the UK, um, the way we treat people is it gravitates a lot around hospitals. I mean, they have done recent reforms. Obviously, they have tried to bring care closer to home, particularly within communities and in the clinic. But I think there is a sort of misconception about, you have telehealth and that's it. You don't have to follow these patients anymore. It's not actually true. Fundamentally, telehealth allows you to be more alert about what's happening to these patients. You are constantly monitoring these patients, and therefore that prompts you to, and therefore you need people, you need actually healthcare staff that is able then to interpret basically the information, the data that is provided through telehealth devices, and also intervene in time. So telehealth is not a magic bullet, but the advantage of telehealth, and I think we've learned this with the COVID crisis, is that it is much safer and also more effective to treat, and also cost effective to treat people at home, rather than having them to reach a point where they are in a crisis and be admitted to hospital. And particularly with the COVID crisis, what happened then? Hospitals became hotbeds of COVID, so they were actually became also the centers in which actually COVID was spreading. So the way I see then telehealth developing in the next 10 years, yes, obviously the use of online consultations is promising in that respect, but I think there is more that has to be done in terms of reforming, how we deliver care, so how our model of care to actually being able to adopt telehealth effectively. And obviously this means investments not just in technology, but also institutional reforms. For example, if you think of reimbursements for doctors, for GPs, for example, that may use these telehealth. And also obviously you need human resources that are available. So you need also investments in human resources that can intervene when is needed.
Those are really great points that you just mentioned. I fully agree with them. So I think we need to transform the way we think about telehealth. Telehealth was always presented to us in the sense that, you have a GP who is having, let's say, earplugs, and he's actually discussing something over iPad or computer with his or her patients. However, it's far more than that.
Yes, exactly. It's more than that, and we've all known because telehealth, basically before we all became familiar with zooming with a GP. Actually, telehealth has been trialed, for example, in the UK for several years. But one of the limitations is that it is always the initiative of a hospital, or it is always the initiative of a champion within a hospital or within a local healthcare setting. So there's never been that sort of drive, institutional drive by the government, by governments. I don't want to say by one government specifically, but by subsequent governments to actually push telehealth and actually have it, being adopted more widely, and therefore achieve impact with telehealth in terms of delivering quality of care, but also potentially more cost effective.
Exactly. I think that's the right word. So it's just figuring out what is the beneficial way of moving forward by taking into account costs. And I think there is not only the need to empower GPs on one hand, and on the second hand also patients to use the new technologies. By empowerment, I also mean to convince them to be more open to new technical solutions. But also there is responsibility on health providers and to make sure that GPs actually take the full accountability of using the data and making sure that they take, let's say, advantage of new technologies by following the patient's treatments more closely, and not just having regular catch-ups every week or every month for prescriptions, but rather really making sure that when they come to hospital, when they come to GP offices, that they're there for a reason and not only to show up so they can have a new prescription, which can, by the way, be emailed to them nowadays. There is no need to even send it to postal address.
Yes, absolutely. And actually, one of my interviews, I interviewed a doctor, and actually it was a project on telehealth. And this GP told me, I mean, for me, seeing a patient online or seeing it face to face is the same. It's still, I don't know, 10 minutes, 30 minutes of my time. So I think that it's important that there are people behind, these technologies, and obviously you need to fund. You need to invest resources also in terms of human resources. It's a bit difficult to think of telehealth as a sort of a replacement, for example, of doctors or nurses. In reality, you're giving them the tools to enhance their work.
Exactly. I fully agree with you. However, we have another factor that we need to factor in when we are discussing telehealth, and that is the uptake of artificial intelligence. I'm curious to learn your thoughts about that, how artificial intelligence will impact the development of telehealth going forward.
I think the artificial intelligence, the way forward of artificial intelligence is actually in terms of preventative and responsive care, which obviously is linked to telehealth in a sense that if you think about telehealth, telehealth is sort of the vehicle through which you gather data about the patients. But the key issues, you have this massive amount of data. So you could have, for example, monitoring devices, self-tracking devices. You could have sensors that you use to gather data about patients. And let us not forget that when we talk about sensors nowadays, recent advancements are not just looking at, for example, if we think of smart homes can also collect information that is about the environment of a home to understand issues of environmental health, whether, for example, the home where someone is living is actually a healthy environment for that person. So you have all these possibilities in terms of collecting data, but then what do you do with the data? So I think in the case of artificial intelligence, this is where artificial intelligence comes in, because you can actually use all these artificial intelligence to gain insights from the data, but most of all, to predict what is going to be, I don't know, whether a person is going to develop a certain condition in the future, even though it could be maybe in, I don't know, 2 years' time or 5 years' time. And based on this information, on these insights, start talking with this person and say, because we think that you, maybe in 2 years' time, 5 years' time, you may develop this condition. I think you can do things to improve, I don't know, to improve your diet, to improve your, if we are talking, for example, of cardiac diseases, improve your diet, change your diet, or increase your physical activity. So I think this is the next sort of where now artificial intelligence is moving. The application of artificial intelligence in healthcare is moving for the years to come.
Roberta, you already mentioned the concept of online health communities and that you are currently looking at these specifically in the UK. Could you maybe explain what do you exactly mean by online health communities in the UK? What's their role, and how do you see this concept evolving going forward?
Yes, I mean, online health communities is not just a phenomenon in the UK. Obviously, my study mostly focused on online communities, who's on an online community for people with diabetes, whose membership is mostly from is basically includes mostly people in the UK. even though as part of this project, I also interviewed people. I interviewed participants from India, from Nigeria, from Australia. But yes, mostly was actually, let's say, a community where most members were actually from the UK. So online health communities are a place where people with chronic conditions seek and receive peer support. And that's because when you have a chronic condition such as diabetes, fundamentally you go to the doctor, they give you sort of, they make the diagnosis, right? So you may have like blood tests that confirm your diagnosis, and they tell you, okay, this is the condition you've got. They may even give you some, I don't know, a leaflet about all the side effects, or maybe a website to the national to the NHS, a link to the NHS website, the National Health Service here in England, in particular, and then say, okay, look at this information, and from now on, it's better that you don't eat this, and this is the diet that you need to follow. So this is fundamentally what happens when you get diagnosed with diabetes. But then people may have all sorts of questions, and they may also need some sort of emotional support or social support. They may not totally agree with the recommendation. Some people may not want to take actually medication, but try to treat diabetes, maybe with diet, but they don't know where to start from. And that's why then they start consulting they start consulting the internet, really. They start by searching the internet, and then they find these forums, and then they decide to become members or to interact with these forums, to ask questions and get answers. And my interest in these communities is about what they believe. So if, for example, you're told something by a doctor, but then the community sort of contradicts what the doctor has said, how do you trust what people in these communities say? And another interest is about how the medical knowledge, and by medical knowledge, I mean not just medical knowledge in research, but also what they learn, what these people learn from their experience. For example, practicing a new diet to manage diabetes, and then they share on the forum. So how this knowledge is exchanged, and whether then this fundamentally could be a source of innovation. Maybe this diet works, but this is something that doctors do not prescribe, and how this is fundamentally adopted by these patients, and then what is the process that these patients go through in terms of learning from these communities, and also sharing these new practices. I mean, like, for example, new dietary practices to manage their condition. And the idea behind this is that these communities, because we know the healthcare, particularly when it comes to medicine, and it's quite understandable, it's slow in terms of innovating, and because obviously to have a rigorous study in medicine that actually proves, for example, the effectiveness of certain types of diet, I don't know, on the management on the management or treatment of diabetes, and have confirmation that these diets work, can take several years. But here we have people who actually experiment. So it's more of a bottom-up approach to innovation than you would have through traditional routes, such as, with scientific medicine. So the idea is, can these communities actually be a sort of a source of innovation, and could healthcare professionals also draw inspiration from these communities in terms of updating also their clinical practice?
I fully agree with you. I think it's actually, following the trend that pretty much today it's not the society who made you diabetic. It's a number of reasons that led to your situation, including also your behavior and the way you used to eat in the past. So I think it's also putting the accountability in people's hands and allowing them to experiment, as long as that is followed by a proper scientific advice, and making sure that your GP and special and or specialist obviously reflects on that as well, because otherwise you could be in a dangerous place if you start experimenting on your own without advising someone who used to treat diabetics for a number of years.
Yeah, but you'd be surprised that actually, it's difficult to explain this, but there are different theories out there about what is the right way of treating diabetes with diet. And the theories that, for example, members of the community I have studied supported is actually not what is recommended by their doctors, simply because doctors follow clinical advice that is given by their public health institutions or by their clinical clinical bodies that basically decide clinical guidelines in a country. And I think that's what is interesting, because fundamentally these people found ways of getting better with a diet that wasn't recommended by the doctor, and fundamentally that maybe the doctor would not agree with, but at the same time they were empowered and they were able to improve their health. And I must say, these people are very, very careful with their health. So they did actually do, it's not that they went there onto the forum and then whatever people were talking about, they were actually believing them and trying it. They actually did a lot of research. So they were actually looking for scientific evidence that would support these alternative ways of treating diabetes with diet. So it's not, I don't want to give the impression that there are these people who fundamentally go onto a forum, believe whatever they are told, and then they may try things that they could be harmful for their health. What I found out with my study was actually the opposite. So they were very careful people. They were making their own research, and they were also speaking about this with their doctors. So some actually would talk about it with the doctor and say, I want to treat diabetes without medication, and this is the diet that I want to pursue. And their doctors, even if they wouldn't agree, even if they didn't agree entirely, they would tell them, okay, just try to be careful. And so yes, so this is fundamentally how people of these communities try to get better and take control. That's the word. So take control of their health.
Quite interesting. So thank you for sharing that point of view and the results of your study. I fully agree with you, and I think you just nailed it in the last sentence when you said take control. Make sure that you're proactive whenever you have a health problem or any other problem. And I think it's also important message to send that you need to check valid resources, and that you need to make sure that you are pretty much looking at all available resources, and trying to make sure that artificial intelligence does not caught an eye on what you are doing, because otherwise you might wind up as most of anti-vaxxer movements do these days, and that is that in the end they receive one story after another repeating what they started to believe in the meantime.
Yes, that's also another interesting point, the anti-vaxxers movements. So there is a striking difference, I think, between the type of community that I have studied and online communities of anti-vaxxers, because there are also forums of anti-vaxxers, and obviously they use social media as a platform to spread their ideas. Fundamentally, if you have if you talk about diet, right, and you say, okay, if you reduce the amount of carbohydrates that you consume in your diet, this is going to decrease your blood glucose. So the blood sugar, basically the sugar that you have in your blood. Well, you can try it, like some people told me, just reducing carbohydrates for a number of days is not going to kill me. So I try it and I test. I use a meter. I use the stripes and I test whether actually I can see that my blood glucose is improving, and then also I can do medical tests at the doctors or the clinical practice to see whether this is going to have a positive results on my medical tests on my medical results. So a positive impact on my medical results. When it comes to these like I take the example, one of the issue with before COVID, for example, one of the arguments that the anti-vaxxers were using was that if you get vaccinated, or if you vaccinate your kids against measles, for example, they are going to become autistic, and you cannot really experiment that. You cannot really observe it, because it's not something that you can experiment with experience. In addition to the fact that there is scientific research that actually has shown that that's not true. In addition to that, it is also something that you cannot really experiment with your own experience by practicing it. And that's why that a lot of the claims that are shared in these communities do not have they do not have a foundation, a ground of truth. Whereas when it comes to things that people experiment, it may be true because someone tried it and it worked. So let me try it as well. And so this is, I think, that the differences between these types of communities.
Thank you very much for clarifying that, Roberta. I think it's a really valid point to say, specifically because there is a crucial misunderstanding when it comes to certain ideas in personal healthcare, if I can call it, and that's definitely to understand that for certain conditions like diabetes, the way you eat food and what food do you eat can help you. But in case of let's say the diseases that can be widespread by contact with people, you cannot do anything else apart from completely isolating yourself or getting a vaccine. And I think that's a fundamental mistake that people who are actually anti-vaxxers in this specific case do not understand, and they also do not understand the fundamental role of vaccine. And you would agree with that one on me. It is not to completely eliminate the disease, but to spread people, to stop people from dying, to stop the spread as much as possible, and also to limit the hospitalization, which are the crucial issue if we take into account the ongoing COVID crisis.
Yeah, absolutely. I agree. We always and this is what also members of the community I studied were doing. They always wanted to check for the evidence, so the scientific evidence that backs up certain experiences. And I guess you need to go by the evidence. I totally agree with you.
Roberta, I'm curious, how would you rate the state of digitalization affairs, if I can call it that way, of our healthcare systems? What are the issues we need to urgently focus on not to be left behind?
Well, I think if speaking of the UK now, obviously when I say UK, I mostly mean England, because the health service that we have here, for example, is actually across. We have different health services for each of the countries in the UK. But if we speak of England, for example, I think in terms of digitalization, a huge step that needs to be made is in terms of integration of health information systems and patients' records. So fundamentally, when a patient goes to a doctor to see a doctor, this doctor should be able to see the medical history of this patient and easily share it, for example, with a consultant or with a nurse in another clinic. So sort to have this comprehensive picture of the history of a patient. So I think this is an area that is very important. So you need to integrate. You need to have in a system that is integrated. So at the moment, the way most medical records in England are managed is actually through standalone information systems that do not communicate with each other. And this is fundamentally, particularly if you want to use, for example, telehealth, and it's fundamental if you actually in the future you want to sort of use artificial intelligence in the way I explained earlier, in terms of using these as much data you can collect about a patient and across all patients, to then make accurate predictions about what condition they may develop in the future. So I guess this is one of the areas that needs work in order to actually improve the digitalization of the system. Because if you have technologies, but then technologies do not communicate with each other and they cannot share the data, then there's not much value. So it's important to realize that the value of digital technologies and what you can do with it is actually the data. So that's the fundamental issue here. It all starts, particularly in healthcare. You use data to make diagnoses, to make clinical decisions. So this is fundamental. This is important.
What I would only add on that is definitely not to have the proper data, but also to interpret the data, because you can easily find in newspapers written by some journalists that do not understand the basics of statistics. I do not know a lot about mathematics and statistics myself, but when you read as a, let's say, ordinary citizen, that 40% of people are in one or the another reason, 40% of people who are in hospitals are actually vaccinated, you get an impression that if you are going to get vaccinated against COVID in this case or not, it's completely it's not important. But in the end of the day, you need to really go behind and then to realize that the chances of you being vaccinated and not being vaccinated are that if you're not vaccinated, your chances are 7 times higher that you're actually going to wind up in hospital. And nobody's talking about that. People are just presenting the figures like they have heard them and not analyzing the entire picture. I think that's an important message we can send from here. And that is that it's not only the data, but also learning how to interpret the data. And I'm sure, and that has already been a trend for the last past years, and you can correct me that one, that we have more and more data scientists, and we'll be needing even more data scientists to make sure that all the data we have, we interpret them, learn from them, and then move forward, knowing how to act based on this data.
Yes, and I think you've touched on an important point, which I think it also links with the research that I'm currently conducting, because it's about, because obviously data scientists are important, but we don't have to forget that we all have access to this information. The common citizens, and you said the journalists, but also the common citizens has access to this information. So I think we need to sort of make our science research more open and accessible to people, so that they do understand the differences, like what you said about interpreting the data in the right way, in terms of understanding what is the actual impact of the vaccine in terms of reducing hospitalization. And you need to sort of communicate. So you need to change the way you communicate science. So it's an issue of interpretation, but it's also an issue of changing how you communicate science to common citizens, so that they can also make the right interpretation and not being told what it is right. Because I think that's what happens there. When people feel they are being told that this is the way that it should be, and they get all this sort of information that on the surface could be contradictory, and they kind of really make sense of it. So you need to empower these people to try and help them make sense of all this contradictory information, because when it comes to, for example, if we think of COVID, there are not always straight answers to some of the questions that we have about this virus. For example, the fact that maybe we can still see that the cases are increasing, um, and despite maybe some countries adopting certain measures. And that's because not everything, there isn't a universal scientific method to explain these issues. And I guess it's important for people to understand that medical knowledge is actually complex. So and therefore trying to get them this understanding, I think is important.
Couldn't agree more with you. I think next to coding, interpreting data and in general data science is something that is a skill required for 21st century, not even the entire 21st century, but only this year or this decade. And it's important that we get ahead of it and understand it, not only if we are in our 20s or 30s, but also if we are older, and especially if we are younger, because it will become knowing to use the cell phone and Google in the beginning of 2000s.
Yes, absolutely. Yes, definitely. These are going to be skills that are going to be more and more needed as we progress with the future.
Roberta, I'm interested. What are some of the most exciting digitalization breakthroughs, if I can call them that way, happening at the moment? I read recently about 3D printing of medicine, enhancing personalized medicine treatments. I read about artificial intelligence helping us with expanding, and not only expanding, but also enhancing further clinical trials of medicines. What is your take on this? Are you aware of any other exciting digitalization breakthroughs that we are going to learn more about in the months and years ahead?
Well, I think one breakthrough, it actually links to what I was saying before, and I think you kind of so when this idea of personalized medicine that you mentioned, it's about using artificial intelligence and sensors in particular. So sensors, using sensors to collect data about ourselves, for example, our heart rate, or any other um, life signals from ourselves, and then having all this data and use this data to sort of make predictions about what sort of treatment would be more appropriate for us. So that's obviously personalized medicine, but also using then artificial intelligence to gain insights about what may happen to us in the future, and therefore sort of be more proactive. So have instead of treating a disease, try to prevent the disease. So being more so basically putting in place a responsive care to actually prevent the disease from developing by acting before it manifests itself. So I think that's one breakthrough of digitalization in healthcare.
Roberta, I'm also curious, we did not touch base on that. What is your take on the use of robotics in healthcare, especially in combination with artificial intelligence? Will we see more robotic run surgeries in the years to come?
Yes, absolutely. In terms of surgery, I think this has been trialed. I think that there's been a lot of progress in terms of using robotics in surgery. But one field where I can see that robotics can actually make a difference is in social care. So the use of care robots. And this is because if we think, for example, of the situation here in England, there is a major crisis in social care, and that's because we don't have enough carers. The demand for social care is huge, and is increasing as time goes by. and therefore you don't have enough people actually to take care of people who are in need of social care. Just to give you an example to make you understand the extent why this is important. So what happens is that when a person, for example, if an elderly person is in a hospital and they have received hospital care, hospitals take much longer to discharge these patients because they need to find a place in care. So this is not something a hospital should do. That's because care in hospital costs a lot. So, and that, just to give you these examples, so there are not enough places in social care to take care of these people. If we think, for example, of residential homes. And therefore, if you had robotics, for example, a social care robot that could actually take care of an elderly person or a person who is in need of social care in their home, that would definitely contribute to solve the crisis.
That's quite interesting line of thought. Thank you for sharing that one. Roberta, I'm aware that we have a limited time and that we are almost towards the end of our conversation. But before we come to the close, I would also like to ask you about your next research goals or challenges. What are these? And can you maybe share some of those with us?
Yeah, my next research challenge, I'd like to expand my current project on online communities and to social media. And particularly, I would like to understand more about the source of influence. So, who actually is a source of influence about these different ideas? And as you said earlier, for example, it could be also related to vaccines. Okay, these ideas about vaccines. How basically, who are the influential actors on social media that actually spread these different ideas or spread this information or even misinformation, and what impact is this going to have on the trust in public health advice. So this is fundamentally where I would like my work to move forward in the future. And I would also like to experiment with new methodologies in social sciences, particularly computational methodology in social sciences, for example, with the use of machine learning in terms of mining text from social media and gather meaning from data from text on social media to sort of provide a more comprehensive, let's say, representation of what's actually of the phenomenon of what's happening on social media when it comes to the diffusion of I don't know, information or misinformation in relation to healthcare. So I guess that these are my major challenges for the future.
Roberta, any last words? Anything else you would like to mention before we come to the close?
I would just like to thank you for giving me this opportunity to talk about my research. And yes, I'm really glad. So thanks for inviting me to this.
Roberta, thank you very much for being my guest in the RNT Podcast. Thank you very much for sharing your research and also the goals that you're trying to achieve long term. And thank you for also helping our society to understand better the impact of, let's say, healthcare innovations and digitalization on the way, on our way to the more sustainable and healthier future, hopefully.
You're welcome. Thank you.
Thank you.